Hello, welcome to Dr. RS channel. This is Dr. Riffat Sadiq. I am going to talk today a problem which is getting so common, and that's a psychiatric problem in very young children, in youth, and it is getting so common that it's so worrisome. I just wanted to talk about this for so long. So today I'm going to just discuss some of the few things which I have been observing, and I wanted to talk about this, that how we can even, if we can think about it, if the women who are pregnant or mothers, young mothers, they can actually listen to this my video, and maybe they can bring any change to their life, any change to the young children, or maybe we can save one psych problem in one child. So I hope that you watch this video to the end and see if anything can be helpful to your life. So I'm going to talk about how actually psych problems happen. It doesn't happen when the children are like 5 years old or 10 years old or teens. Mostly you see the problems in teens. It doesn't start when they are in teens or when they are young adult. It starts when they are in the belly of a mother. When the mother is pregnant with that baby, the problem starts there. And you would ask me how? Actually, the child is directly connected with the mother through the blood. What mother eats, what mother thinks, what mother's surroundings are, they all matter. What kind of household that a mother has, what kind of relationship that mother has with her husband or the loved one, or what kind of relationship that mother has with the people surrounding. So that baby is now actually connected directly to the mother, and whatever is happening in her life is happening with that child. So some of the cultures and religious, their practices are that when a mother is pregnant with a baby, they should recite some of the holy book, like Quran or Bible, or Torah. So they actually give peace to the child. They should recite loud, that when they will recite these verses, so the mother is relaxed and the child is relaxed. So he or she will develop this personality in the belly, in the womb of the mother at that time. So if you imagine some of the culture or some of the religious, or I think it's more of a cultural, that they tell their pregnant women to do a lot of math, to a lot of physics or chemistry or science subjects, and read it loud or do some mathematic exercises. They think that if mother is doing intellectual work or reading some history or reading some books which are intellectual, or they think that it's going to, if mother is doing the reading, it's going to affect the child. So I think there are some examples of now even people are doing, and they think that children are born smarter. They think that children are born more intelligent or more towards like their brain develops in a different way. It's a development of brain. So whatever mother is thinking, whatever mother is doing is like helping the child. So another thing is, if you have an abusive relationship with your loved one, I mean with your spouse or your husband, or abusive relationship, people in the household, it's directly going to affect the child's personality. Because mother is stressful, mother is like anxious, mother is afraid and fearful. So it's directly going to, the child will be born with these feeling. Child will be maybe has some personality where with anxiety will be very pronounced, or from the beginning you will see some children, you will see the personality of a baby when they come out, right? You will see some babies are very calm, some babies are very they will cry a lot. I have seen that. And some babies are they are very quiet. They don't move a lot. They are like the child will have a personality from the first day. So it means that the personality was getting developed in the belly. So now they are out. Imagine now baby is born today, and baby, what happened? Baby is taken away from the mother, and the baby is now in the nursery. Mother is here in the room, baby is in the nursery. They are brought to the mothers only when they are actually, they need a breastfeeding, if mother is breastfeeding. Otherwise, they are right away. I have seen a lot of time they are fed by the bottles. So they are not even having, mother is not even feeding for many reasons. But I'm going to give a suggestion here, right here. If mothers think that the baby should be closer to them and baby should be healthier, baby should be get less sickness in life, start the breastfeeding. If you don't have any reason not to feed, that means sometimes there's sickness or there are problems, health problems. For that, if you don't have that reason, please start the breastfeeding. Don't give them the bottle feed. And also I have seen the mothers, they will pump the breast milk and give the bottle. No, you need to hold the child tight to you, hold them. The touch is very important. When you will bring the child closer to your body, that's where you get bonding. That is very, very important. So I'm going to go back now. So in the hospital, the child is in the nursery, mother is in the room. What happens? Child was so close to the mother in the belly, right? Now he's out, he or she. The child is now separated from the mother. So psych problem starts there. Now the child is fearful because he or she is not close to the mother. So I think that is problem number 2. One was in the belly. All these things can happen in the belly. Now number 2 problems is in the hospital or where the child has been separated from the mother. So we need to do something on that. Maybe we can bring those cribs in the mother's room, so the child is closer to the mother, or at least hear mother's sound, or at least more close to the mother. So there are solutions to the problem. Instead of putting in the common nurseries, and in that nursery, every shift there is a new nurse, there's a new face, there is a new voice. So now we can avoid those things and bring the child to the mother's room in the hospital. So less anxiety, less fear in the child's life, which is like a first day. So this we can implement this. It's not a big deal. There are rooms are of pretty good size, so we can bring the crib in the mother's room unless there is some sickness or there's some other things which we can actually in those cases. So now child comes home, and in case where mother and father are both working, imagine, I have seen like 4 weeks old child or even 3 weeks old child, even 2 weeks old child is now in the daycare. In the daycare, it's so heartbreaking. So in the daycare, what happens? New staff member, new people are handling that child. And in the morning, they're rushing, dropping the child, and then they're coming, bringing him home. Now, imagine how many new faces the child sees in a day, how many new voices child hear that. But we can minimize it. If one of the spouse can actually hold on, on their kind of a career for a little bit, and then maybe work from home. These days it's like a good thing working from home. Or maybe there should be some leave which can be extended to few months. So I think there has to be, like, mother should be given some time because it's a long process, giving birth, feeding. So mother should have some time, extended maternity leave, where they can actually bond well with the child. They actually really, that way the child will be really have a good psychological and physical health actually. So I think I think Canada, there are 12 months they give a mother so that they can spend time with the children. So that's very, very important. So there are solutions to the problems. So then come to the daycare. We were at daycare. So now there's new people at daycare, new things, new environment. The child is already getting scared and afraid. Now come to the school. So imagine 5, 6 years old a child who already is gone through the separation on the first day, separation anxiety, and then he or she was in the daycare, now in the school. So because the children at this time, they already has developed, some are anxious, some are depressed, some have now ADHD. So there's, because the labeling is so common these days. So we label children very quickly. This child is ADHD, this child is depressed, this child has this. So we have to be extra cautious to label the child. We also have to see how we can avoid these things, as I mentioned earlier. So by doing simple things, we can really cut down our psychological problems. Then comes to the teens. Now imagine the infrastructure at home is such that everybody's working, nobody has time for each other because we are in rush all the time. We are on the either at work, it's like our life is at a fast pace. So when we bring the child to this world, we have to plan things ahead of time, that can we spend enough time with children, how we are going to train them. We live at the mercy of daycares, at the mercy of strangers. My child, I would be the one who would love my child the most instead of other people. So we have to think about it before we bring children to this world. Are we ready for it? Not like we are going to leave them at the mercy of the TV. Then as children are like 4 or 5 years old, now they are eating and they are watching on their babysitter is the cell phone, babysitter is the TV. So who is training them? Who is teaching them what is right, what is wrong? They are like clay. They are like, you can mold them any way you want. So actually, we need to spend time with children. We need to tell them what is right, what is wrong. TV and daycare, they will not teach the values which you want to teach the value system. So, or if you see your child, then they say, oh, child is hyperactive, because they need attention from you. They will act out. They will show that they are stressed out because they need your attention. So, everybody, now every second or third child has ADHD, attention deficit disorder, because they need your attention. There is deficit. From the first day, they needed attention. So they will act out. So we need to work on simple things. Little more time, from the first day. Maybe you will see the difference. I am giving this message to the new mothers. Please listen to this. Maybe whatever change you can bring in your schedule, do that. When you're pregnant, talk to your baby. Talk nice things. Imagine good things. Imagine, a clean, nice environment. You will have a peaceful baby. And then when baby comes to this world, you spend more time with the baby, bond with the baby, so that when you will grow older, that baby will take care of you. If you will take care of this baby today, bond well, strong bond, that baby will take care of you when you will be like 80 years old or 90 years old or older age, because it's what goes around comes around. That's how it is. So you need, older people are just like children. So we have to start when you conceive. You start thinking when you conceive. So I hope that this video would bring any change in anyone's life. And thank you for watching.